My name is Walter Green. I'm a fourth-year emergency medicine resident at Yale New Haven Hospital. My project is called the Association of Sleep Hygiene and Drowsiness with Adverse Driving Events in Emergency Medicine Residents. So just to get into the background here as to what led to the development of our study, we know that drowsy driving contributes to thousands of motor vehicle collisions every year, yet it remains an underappreciated form of impaired driving compared to alcohol and drug impaired driving. Medical professionals are at high risk for sleep deprivation and subsequent drowsy driving, and specifically emergency medicine physicians and physicians in training are at especially high risk given the sporadic nature and timing of their shifts and the transition from days to nights and back to day shifts. Prior research has shown that 75 to 80% of motor vehicle collisions in emergency medicine residents occur after an overnight work shift. So thus we sought to look at how subjective sleepiness and adverse driving events in emergency medicine residents are related to each other after an overnight work shift in that population of people. And additionally, we were interested in how sleep hygiene, which is an assessment of an individual's stable sleeping habits and level of training, were associated with the above two factors. So just like emergency medicine residents are expected to become more proficient clinically and procedurally as they advance in their training, are they also do they also become better at driving home after an overnight shift? So our specific aims were to assess these characterize and assess the association of adverse driving events with subjective sleepiness, level of training, and overall sleep hygiene in emergency medicine physicians in training. So what we did was at the specific training site that we did this study, there is a community hospital site about 20 miles away, and it requires residents to drive to and from the shift. Obviously, there's a little bit of variability there, but the residents that were enrolled were sent a survey asking them to fill out the Karolinska Sleepiness Scale, which is a 1 to 10 scale assessing subjective sleepiness, the Sleep Hygiene Index, which assesses your overall sleep hygiene behaviors, and then an adverse driving events questionnaire, which had 15 items asking the participants to say yes or no if they experienced one of the adverse driving events on that questionnaire during their ride home after that overnight shift. And I gave two examples here of specific things that were asked. You know, did you pull over to take a nap? Did you drift out of your lane? And there were 13 other similar questions. So just to highlight some important results, we grouped the PGY1 and PGY2 classes at this four-year training program as junior residents, and 88% reported adverse driving events with an average of 2.97 total events. The PGY3 class, 79% reported events with an average of 2.57 total events, and the fourth-year class, 75% reported adverse events and 1.33 total events was the average across that class. And I should say we had 50 total participants, which was a really good number based on the number of residents at this program. So just a couple other important associations that I want to highlight. Sleepiness was significantly associated with adverse driving events, and level of training was also significantly associated with adverse driving events. Additionally, the sleepiness level, the subjective sleepiness level on that 1 to 10 scale was asked of the participants immediately after the shift before driving home and after completing the drive home. And that level was initially 5.58 before the drive, and then after the drive home on that 1 to 10 scale was rated at a 7.04. So there was a significant increase in subjective sleepiness level amongst the participants there. So just to highlight our three most important conclusions here, higher levels of subjective sleepiness were significantly associated with increased self-reported adverse driving events. Increased levels of sleepiness were reported after completing the drive home compared to those levels reported prior to initiating the drive. Obviously, that's important because I think a lot of people start driving home after an overnight shift feeling less tired than they actually are and putting themselves at risk for motor vehicle crashes later on in their drive. And then thirdly, senior residents reported a lower number of adverse driving events compared to junior residents. So just some future directions and implications of our study. We'd love to do a larger scale naturalistic study or a driving simulation study. But based on the data we do have, we think it's a good starting point to say that we can make a change here, and that there should be intentional drowsy driving related education to emergency medicine residents in training, and likely all residents of different fields, but specifically emergency medicine residents should be educated, especially when they start residency, knowing that they may be at higher risk as junior residents who potentially have never driven home after overnight shifts before. And everyone should know that they potentially will feel sleepier at the end of their drive, putting them at higher risk compared to how they feel when initiating the drive. And I think this leads to possible solutions, safer alternatives to drowsy driving, utilizing call rooms to sleep before driving home, rideshare programs, and especially for residents, potentially a consistent night float program where you work all your nights in 1 month and have less sporadic night shifts throughout the rest of the academic year. So I want to say thank you to the co-authors on this study, and I appreciate everybody listening to this presentation. Thanks.